Hi, I'm Dr. Joan Greco. If you're watching this video, someone has referred you to get your wisdom teeth out, or your wisdom teeth are hurting enough that you're thinking about getting your wisdom teeth out. There are several reasons for having trouble with your wisdom teeth or having to have them taken out. One of them is that you got large teeth from one side of the family, small jaw from the other side, and there's just not enough room for your teeth to come in. Some of you may have had braces, and that's also for the same reason. Your teeth have been crowded, and now your wisdom teeth are trying to come in, and there's just no space for them. If allowed to continue to come in, they will simply start growing into the molar in front and possibly shift that out of place. If they do start to erupt into the mouth, it gives it a place for food, bacteria, and saliva to slip down in between the gum of that last molar and the wisdom tooth. In doing that, it can cause decay on the back of your second molar, as well as decay in the wisdom tooth that's under the gum. Sometimes you won't know that there's a problem there until it's too late. Too late being decay caused on both teeth, with the possibility of losing that second molar as well as your wisdom tooth, which is considered the third molar. Also, wisdom teeth are so very difficult to clean no matter how good you are. It's very, very difficult to get in the back to be able to clean that area. Now, oftentimes wisdom teeth are trapped in the bone, and a good example of that is this. You'll see how this wisdom tooth is growing into the molar in front of it. There'll be enough of a cleavage point in there that you will not be able to get in there and clean, but food, bacteria, and saliva can get in there and cause damage. On the upper, you can see that this tooth is coming down. It will usually hit the bump on the back of that last tooth and be turned sideways. As it is, it will continue to erupt, usually rubbing up against the cheek on the inside, or over the gum on where your bottom wisdom tooth is. As long as we're looking at this x-ray, I want you to see that this dark line right here usually has two fine white lines next to it. Indicates where your nerve runs. That nerve gives you sensation to your lower lip, chin, and teeth on that side. There's a nerve on either side of the jaw. And that's one of the things that we want to watch out for. On the upper, this is the floor of the sinus. Even though we look like we're close there, in reality we're not that close, and chances of having trouble opening into the sinus is pretty slim to none. Okay, so you probably want to know what you're going to expect when you come in to have the wisdom teeth out. But if your dentist finds, or if we find that you in fact do need to have your wisdom teeth out, we will give you a choice to do it either awake with just local anesthesia. You can be awake with some nitrous oxide, which is a little gas hood that goes over your nose, and you breathe laughing gas. It'll make you feel like you've had one or two beers, for those of you that have ever had a drink. Then there's a possibility of oral sedation. It's a small tablet you take, usually a sleeping pill, that will give you about 45 minutes prior to a procedure. It's just enough to be able to calm you and make you comfortable. The last option is IV sedation. That's where we put medicine into your vein, intravenous. That's what the IV stands for. And that will put you under what's called conscious sedation. Conscious in as much as you are aware enough if we ask you to take a deep breath, or if we ask you to open your mouth, take a cough, deep breath and cough, you can do that. Sedation in as much as you don't remember what's happening around you. You don't remember any of the trauma of the procedure. So let's say you choose IV sedation, which is what most of our wisdom tooth patients decide to go with. You can expect coming in that morning, nothing to eat or drink after midnight the night before, not even water. It's okay to brush your teeth, but don't swallow any of the water. When you do come to the office, we'll get you seated in one of the rooms. We'll go ahead and get monitors on you, one in each, under each shoulder and one on your tummy. And then we'll also get blood pressure cuff on and something to measure the oxygen in your blood system. Once that's all in place, we'll go ahead and get your IV started. I'll talk to you, of course, at that point to make sure all of your questions are answered. We'll then get your IV started to give you some medicine to make you nice and sedate and sleepy, which means you will be comfortable and you won't remember anything. Once you're asleep, I'll go ahead and get you numb, and you'll be numb for about 2 hours. So that should be enough time for you to be able to get home before the numbness wears off. Now the key is going to be before the numbness wears off, you take one of each of the medicines that we give you. That way you will wake up well rested and comfortable. If you don't take the medication and just fall asleep, the pain is going to come on strong, and it's going to be very difficult to try to control again. So again, before you crawl back into bed or on the couch, make sure you take one of each of the medicines. Now the bottle of medicine will say to take with food, but your first dose is okay with just water. After that, you can get some applesauce, mashed potatoes, poi, something, a few tablespoons to line the inside of your tummy. So that way, when you take your medicine, it won't irritate your stomach as much as it would otherwise. Now, after your first, so that's after your first dose. Other than that, today's diet is just clear liquids, which means if you can see through it, you can have it. So we're talking about clear juices, water, sports drinks, Jell-O, freeze pops, popsicles, and broth. Starting the second day, you can add your dairy products. So milk, yogurt pudding, ice cream, milkshakes, and smoothies. I caution you to stay away from smoothies with berries. The little seeds will go down into the pukas, or the holes. Stay away from rice because they act like a little torpedo. They'll go right into those holes. Also, no carbonated beverages and no drinking through a straw for a full week. Now, let's talk about what's going to happen when you leave here. You will have some bleeding. We will give you gauze to go home with. You fold it up, bite down on it. It's the biting pressure that will stop the bleeding. You can stuff the gauze back there and it'll soak up a lot of stuff, but it won't stop anything. So you really need to bite on it. You're going to get some blood on your tongue. Make sure you brush that off. Otherwise, it's going to start to taste and smell bad. Last thing about brushing, you can go ahead and start brushing tonight. Get the insides, the biting surface, and on the outside up to the very last molar. There will be a stitch behind that last molar. It's the kind that will either dissolve or fall out by itself. But if you get your toothbrush stuck in there, you will see stars. One more word of caution on the bleeding and why it's important to have a liquid diet today. You have not had anything to eat since midnight last night, and you've got acid going on in your tummy. You will swallow some blood. The two of those things mix together. If you try to put solid food on top of it, it doesn't mix well. Chances are you'll get nauseated and throw up. The clear liquids will dilute that, send it out through your body, and make you more comfortable. Okay, now swelling. You will be swollen. Swelling will peak or be at its greatest on the third or fourth day. So what you need to know is there are 3 things that you can do that you are responsible for on day 1 and 2 that will keep you from swelling too much on day 3 and 4. I know that you're not going to feel like doing it today and tomorrow, but really important to know that you feel good only because of the drugs. So it's an illusion caused by the drugs. So very important to follow these 3 simple instructions, and you should be fine on the 3rd day and be on autopilot. First thing is sleep with your head up, either on 2 or 3 pillows or in a recliner. The idea is you want to get your head above the level of your heart. So if you have a bottle that's half full of water, tip it on its side, it's going to go completely horizontal. Tip it up a little bit, it stays towards the bottom. That's exactly what we want to do with your head so that you don't get more blood flow up here. Second thing is ice to your face as much as you can. Now you can use chipped ice, cracked ice. You can use frozen peas and corn. They can form nicely to your face, but they get mushy after a while. You can use hamburger frozen in Ziploc bags. You can get a piece of steak and cut it up, and actually, like Spanky and our gang, where they put a piece of steak over their eye when they get hit, it actually maintains its coolness for quite a while. So that's another thought. But one of the best things to use are the gel packs, the ones that you use for the eyes, because they wrap around the face nicely. So head up, ice to your face, and then take the medications we give you. The ibuprofen, if you're able to tolerate ibuprofen, is really good for swelling. It also gives good pain relief, but it's great for the swelling. The other one we give is dexamethasone. It's a tiny little tablet. It's a steroid. It's what will keep you from looking like a chipmunk. So really important to go ahead and take that too. Now, if you don't remember anything that I'm telling you, you can listen to this again. you can go to my website, drjoangreco.com. You can watch the video there. You can read the instructions over that we've given you, and probably have 2 or 3 sets of them. But if you don't, you can go to the website and get the instructions there. And if all else fails, you can call us at the office, 323-3434, 885-9000, or the absolute best way to get through to me is my email, because I respond to my emails, and that is justdrgreco@gmail.com. So that's justdrgreco@gmail.com. I hope this video was informative for you, and we will see you soon.